Can patients film me without my permission? Hi everyone, my name is Mohibur Rahman. I'm a portfolio GP and the medical director of eMedica. So you might have seen the recent BBC article talking about patients recording consultations, either using their camera or just recording the audio, and in some cases even posting them onto social media. So let's look at some of the issues around this and the rules, regulations, including what the GMC has to say about this. So the first thing is, in the UK, there is no law against patients recording their own consultations. Whether that's covertly, openly, audio or video, it's something that is within the law. What they can't do is do anything that would breach someone else's confidentiality. So I'll give some examples. If a patient comes to see their GP and they wanted to record their own consultation, the door's closed, they're not going to capture audio about other patients or other rooms, they're within their rights to do that. Now, if the doctor prefers not to be recorded, they can't stop the patient recording, but they could express the fact that they prefer not to be recorded so that it's actually on the record, if you like. It's also good practice for you to ask for a copy of the recording to add to the record, but the patient isn't obliged to share that with you. Okay. In some cases, they might have a legitimate reason why they want to record. Someone might want, for example, their parent who's not available that day to maybe, go over and know exactly what was discussed. If it's something complex, they might have a family member that they want to share it with to discuss some of the things that have been highlighted. All right. I'll shoot a separate video where we'll look at actually some of the reasons why there can be a benefit in patients recording their own consultations. Okay, so back to what the GMC has to say about it. What the GMC says that if a patient wants to record their consultation and it's not impacting other patients' confidentiality, then the doctor should continue to be professional. They should be transparent. Doctors should not let the fact that the patient's recording get in the way of the quality of care that they offer. And for example, it would be inappropriate for them to say something like, look, if you don't stop recording, I'm not going to examine you, or I'm not going to take any part in this consultation. That's an inappropriate thing to do. Okay. Now, if someone was to record in a situation where it might breach other patients' confidentiality or cause disruption, in that situation, the doctor should address this. So if someone wanted to, for example, record in an A&E environment where maybe there's just a curtain, there's another patient there, they're having a consultation, and anyone that was recording, it would pick up confidential information about someone else, that would be an inappropriate breach. So I hope you found that helpful. If you did, do like, share, and do subscribe to the channel. We've got lots more content to come. Thank you so much for watching. I hope it's been useful.